So complications during skin cancer surgery, any skin cancer surgery, you've got to think about patient factors before you've actually operated. Are they a smoker? Are they a diabetic? Do they have peripheral vascular disease, especially when you're working on the lower leg? Do they have dietary problems with vitamin deficiencies and poor nutrition that's going to interfere with your healing? Do they have infections, intercurrent infections on the skin? Those are a lot of things that need to be thought about before you actually embark on cutting a skin cancer out. Because if you have a problem, that patient's going to have a problem for weeks and weeks to resolve. So other issues during surgery, ignoring the bad techniques, and we're just looking at the actual surgery itself, there's always problems with infection. So a poor aseptic technique, poor tissue handling. If you handle the tissues too roughly, you can cause a lot of damage. If you're not wearing a mask and you're coughing into the patient wound, even just talking with your colleagues over the wound, you can cause infections. If you damage the blood supply to the tissues that you're dealing with, will cause problems. The other issue people can encounter during surgery is bleeding, and you have to think about, before operating, is the patient on blood thinners? Are they on warfarin? Are they on any other medications that could interfere with their coagulation? So those things have to be thought about before you start. During surgery, if you do encounter bleeding, usually a bit of pressure will stop it. If it's a bleeding vessel, you can either tie it off or cauterize it. So you must have cautery. The other thing with cautery is, if you over cauterize, you can cause distant damage to vessels that aren't affected. So in turn, that will compromise the blood supply to your tissues. If in your planning you haven't got it quite right and you still can't close the defect, whatever you've done, you can just put sutures in it. What's left over, you can always rescue or salvage the situation with a skin graft. If it's beyond what you can do, you can always put a dressing on it, and there'll be many surgeons or plastic surgeons that would be comfortable in you just putting a dressing on it and sending it along to them, and they can sort it out. The most important thing in skin cancer surgery is you must know your limits. You must know what you're capable of. And you've got to always think ahead. If something happens, what do I do? You've got to have all these steps thought of previously, prior to starting. You know, what's my get out of jail card? What am I going to do to get out of trouble? And again, when we teach this all the time, when planning something, you must have what you would do initially and what your plan B, plan C, plan D are. You know, if it doesn't work out with your plan A, then you go to the next stage. The other important thing is, once you start marking out a lesion, once you give anesthetic and start cutting, all your landmarks are distorted. So do not change them. Once you've drawn your lines, do not change your mind. Cut along those lines.